Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist.
And now we go to the shoulder. So the shoulder is going to be a group of four muscles: the upper trapezius, the supraspinatus, the infraspinatus, and the rhomboids. So the upper trapezius we're going to petrissage. Compress, compress, compress. This hand is simply pushing up on the tissue so it's easier to grasp the muscle. It's just supporting that tissue. So I would do that in 3 segments, 2 or 3 times. Then, and when you're doing that, you want to be standing at the side of the table. Then you're going to walk around facing the foot of the table, and here's the spine of the scapula. You want to lock your thumbs up under that spine and glide laterally. This treats the supraspinatus muscle. Then come around to the side of the table again, where you're now facing their head. Using your knuckles, glide laterally below the spine of the scapula. The other hand buffering that. And then the inferior angle of the scapula is here. You're going to glide up along there. This covers the teres major and minor, also scapular muscles. Then coming around again to where you are facing the foot of the table, standing at about a 45-degree angle because the rhomboids are in this region. They insert on the medial border of the scapula. So you glide with your thumbs, 2 strokes in each segment to the medial border, go down to the next segment, 2 strokes in each segment, go down to the next segment, and only go to the medial border of the scapula. Here's the inferior angle. Sometimes people will continue on down. It's not that that's harmful, but it's no longer the rhomboids. They ended here. As a transition stroke, do friction, and then we're going to be going over to the other shoulder. So compress, compress, compress. So this is just a pincher compression type of stroke on the upper trapezius. Coming up and facing the foot of the table so that you're looking that direction, and you lock your thumbs up under the spine. One thumb may have more pressure on it than the other. That's okay. The other one's there for support. Coming around to the side of the table, below the spine of the scapula with the knuckles. When we get into more detail work, you'll be doing this with your thumbs, but we're doing a general massage right now, so we're doing broader general surfaces. And then from the inferior angle, coming around to the rhomboids at a 45-degree angle from the spine, just to that medial border. Don't flip over the border. That doesn't feel good. So when you feel that, sometimes people mistakenly think, oh, there's this big knot here. You feel that big flip? It's not a knot. It is the scapula. And of course it feels hard. It's a bone. Okay, then as a transition stroke, we do the entire back. And then we're going to come up and do the neck, where we're going to petrissage the neck. Now, the word petrissage is used somewhat loosely here because we're going to grasp and lift and grasp and lift, but we are going to slide. So by definition, petrissage doesn't really slide. There isn't an adequate description of this stroke, but it feels good. So it's a pinch, lift, grasp, slide. Pinch, lift, grasp, slide. Then coming around to the side of the table, with your outer arm, you'll be tractioning down slightly on the trapezius, and with your thumb, you'll be gliding up the lamina groove in the neck. And you're only treating one side, so the thumb is the treating surface. Then you walk around to the other side and do the friction again, or the petrissage again. And again, gliding with the thumb, gently tractioning down with the other hand, sliding up the neck with the thumb, just along the spinous process there. Then coming to the base of the skull to do digital kneading, small circular motions, crowding up under the occiput. And so just 2 or 3 small circular motions, move out laterally, 2 or 3 small circular motions, and move out laterally again. That finishes the neck, so we do a friction stroke in the entire back. And then we're going to do knuckle stroking. So in Kellogg, this is in the stroking category, but it's more like friction. So this is using the knuckles, using firm pressure. An easy way to think about how to do this is if you support your hands at the index finger and cross the thumbs, that'll create a pretty stable mechanism that you can glide down with firm pressure. By now, there's been a lot of pressure, and the skin and muscles are very warmed up, so you can do this with a pretty good degree of force, but always to the tolerance of the patient. So some knuckle stroking, more friction. Then the nerve stroke, again making that peace sign, putting one finger on either side of the spine, the other hand on top to support, and sliding down the entire spine. And then back for friction stroke. So at this stage of the game, we're winding down from the back routine, and we're just finishing up. Then from here, we'll go into percussion. There's not a right or wrong way to do this. I usually start with hacking. And then you can just transition the shape of your hand into tapping. Again, you can do both sides at the same time, alternating them. Not a right or wrong on that. Spatting. Clapping or cupping. And then I usually end with hacking. And then a friction stroke. And then stroking, and I'm going to come around to this side of the table because I want to be in a certain position. So I'm doing palmar stroking. And then to end with rocking by resting the left hand on the base of the neck and the right hand on the sacrum, and rocking gently with the right hand. You don't rock with both hands, and it's a slow, rhythmic, gentle rocking. This is a polarity move. It's a nice, gentle way to end the massage. And then slowly allow your rocking to come to a natural resting point and just hold passive touch for several seconds at the end.